Yeah, hello, good morning. Hello, good afternoon. My name is Barbara Serwaa Nanko from Ghana, and I'm an occupational health and safety practitioner and also a member of the IOSH community. Today, as we all know, we are here to have the breast cancer presentation. And we know the month of October is past, but yes, so we also have to do our part in the breast cancer awareness. So our learning objectives is basically we are going to have an overview of breast cancer, the risk assessments, how it is being diagnosed and treated. We're also going to find some preventive measures. So breast cancer is everybody's business, man, woman, male, female. In fact, everyone with breast tissue should be concerned. And to begin, I want us to have a very short video that will spark the presentation going. So we'll have it play.
And this is my father, my amazing dad. And he's a wonderful support system.
So I remember I was young and I felt the lump on my right side. So she examined me and she says, you know what? Let's get it biopsy. About a week later, they called me. They said, all right, you have male breast cancer. Then I said, y'all playing with me. Men don't have, they don't get breast cancer. And they said, oh, you got to get genetically tested. And through that, I found out that I carried the BRCA2 gene. I said, wait a minute, I can give this to my kids.
He called and was trying to explain it. And at that time, I think I was like, I'm 32, I'm young, no problem. But then my doctor, she's like, just to be proactive, let's get a mammogram. And that's when they found my cancer.
Right there, I got wow. I passed this on to my kids already. But she said, Dad, we're going to beat this. Don't worry about it. We're going to beat this.
He would go to my chemo treatments. I would go to his. Yeah.
And that's how we got through.
You always hear father and daughter bond, dancing or fishing or basketball. But our bond and what got us close together was breast cancer. I think he saved my life because if he did not find this, by the time I would have hit 40, it would have been too late.
She was my rock. And she's my daughter and I love dearly. But she's my friend.
Yes, so breast cancer, as you all know, cancer is a broad term for a class of diseases characterized by abnormal cells that grow and invade healthy cells in the body. And although breast cancer is far more prevalent in women, it can occur in men as well. However, it is less frequent in men. In fact, science tells that in every 100 breast cancer cases, one will be a man. Like all cancers, the exact cause of breast cancer is not known. Breast cancer starts in the cells of the breast Then it invades surrounding tissues and then it spreads to other parts of the body, which we usually call metastasis. Let's go to some statistics. So globally, the second most common cancer worldwide, aside lung cancer, is breast cancer. And it is the #1 cancer in women as well. In 2022, there were about 1.3 million new cases reported among women. And one striking thing that we should take note of is that for every 14 seconds, somewhere in the world, a woman is diagnosed of breast cancer. Again, with statistics, in the UK, it is the most common cancer in women. And for UK, we also have one woman diagnosed every 10 minutes. So we can see that within the starting of this session, a woman has been diagnosed of breast cancer already. And when we take 7 women, you have at least one of them having breast cancer in their lifetime. And in Ghana, where I'm coming from, in the year 2022, we had 2,900 new cases also recorded. So indeed, the statistics keep on going. And I want us to see the pictorial evidence of what we have just talked about. Let's focus on the image on our right side. We have the top being the survival rate, which is 76%. So in all breast cancer cases, 76% of them are able to survive and live a healthy life for 10 years and more. And underneath it, we have 23% also preventable cases. So those of us joined today, if you have already been diagnosed, let's strive to be among the 76%, that's our survival rate. And if not, let's be among the 23% who can prevent being having breast cancer disease. So with the last statistics, in every minute worldwide by WHO, 4 women are being diagnosed of breast cancer. The struggle is real, as we saw in the video, for both men and women. And so we have to all do something about it. That is why October, the month of October, is a month that is used for breast cancer awareness. And we call it a pink month. Yeah, that's why I'm also in a pink jacket. So Breast Cancer Awareness Month, Pink October, is considered so important because actually signs and symptoms of breast cancer can easily be identified. Most of the breast cancer cases that you know are even detected by themselves before they even go for a mammogram. And the types of breast cancer that we are going to talk about today, we have the ductal carcinomas, which usually form in the milk ducts. We also have the lobular carcinomas, which form in the milk-producing lobes of the glands. There are also a rare type which also occur in other parts of the breast. And now, talking about the distribution of breast cancer, it's more slightly common on the left side as compared to the right side. And the left-sided breast cancer is also more aggressive and has poorer treatment outcome. In people with a female anatomy, breast cancer usually appears in the upper outer quadrant of the breast, extending to the armpits. And in people with a male anatomy also, because they usually have a smaller breast tissue, their breast cancer lumps are located near the nipples. Yes. And again, on distribution, people of white race are slightly more likely to develop breast cancer than Blacks, Hispanics, and Asians. Black women are at the highest risk of breast cancer deaths due to more advanced stages of breast cancer that is diagnosed at a younger age. And with the stages of breast cancer, we also know that that is what is used to describe the extent of the cancer. So it's usually staged with Roman numerals starting from 0, which is the earliest stage, to 4, 1, 4, and 1V, which is the most advanced stage. And knowing the stage is what guides the treatment plan for each person. The stages are based on the size of the tumor and then the extent of spread. So this is a pictorial view of the breast tissue. We use the female breast because it's a little bigger, so you can see it better. And as we said earlier, The part that is usually infected, that usually has the breast cancer, sorry, is the upper outer quadrant. And we see there is the part that is shaded in the red, light red, for both the red and the right and the left breast. So those areas are the parts that usually you will find breast cancer lumps. Knowing all this, what are the risk factors for breast cancer? We have to take note that globally, about 50% of breast cancer develop in women who have no identifiable risk factors other than growing old and being a woman. Yet, there are a lot of risk factors which we also have to take note. We have the age, family history, tobacco use, obesity, history of exposure to radiations, postmenopausal hormonal therapy, limited physical activity. For usually breast cancer, risk factors are grouped into non-modifiable and modifiable groups. So we'll begin with the non-modifiable, the ones that we cannot prevent. We need to know all these to be able to know how to prevent it, to be able to fit in the 23% that can prevent getting breast cancer. So we have the non-modifiable group. Age, you can't control aging. I mean, you are either dead or alive. And for your sex, you can't control it. The family in which you are born with, family history of breast cancer, ovarian cancer, they are all non-modifiable risk factors. We also have previous history of breast cancer, breast disease, certain inherited high penetrance gene mutations, the BRCA1, BRCA2. We also have the PAL2. You can't control these things, yes. And then early menarche before 12 years, and then late menopause after 55 years. All those are things you don't have control about. What about the things we can control? We have being overweight, obesity, especially postmenopausal obesity. We also have alcohol, we have smoking. We have sedentary lifestyle, poor diets, previous treatment using radiation therapy to the chest. That, for example, what is used when they are treating Hodgkin's lymphoma. We also have combined hormonal replacement therapy. Again, we have certain oral contraceptives and exposure to the drug diethyl stilbestrol. That this is DES, and around 1980s, it was being used to treat abortion. So women who took DES, and also let's take note of mothers who women whose mothers took DES while they were pregnant with them are all susceptible to breast cancer. We also have now parity and having the first child after 30 years and then not breastfeeding. These are some of the risk factors we can work on. What about our men? It's basically very similar to that for women. For men, a family history is also one risk factor. They also having the genetic mutation, the BRCA1, BRCA2 is also a risk factor, as we saw in the video that we used to begin the session. Also, men who have cirrhosis of the liver, this condition lowers the androgen levels and increase estrogen levels. Also, men who have hormonal therapy treatments, drugs containing estrogen, are all facts that increase their risk for breast cancer. Again, I'll mention Klinefelter syndrome, which is when a man has an extra X chromosome, and again, getting older, we don't have control over. Overweight or obesity is also there, and men who had undescended testes, and also men who have had radiation therapy to the chest. So all these are risk factors. Now that we know them, what do we have to look out for when we are trying to prevent breast cancer in our assessments? So we have to look out for these signs and symptoms. Change in the nipple appearance, bloody discharge, lymph, lump in the breast, change in the breast color. Some may have pitting of the skin, and there may also be pain. Yes, we look out for all these signs. And what methods do we use for screening to look out for these signs? We have the self-breast examination. We also have clinical breast examination. And then we have our mammograms, the USG and the MRI. All are used to screen for these signs and symptoms. And again, when we screen and then we see something, a diagnosis is made. So a diagnosis is made during clinical assessments. We now have a breast imaging. Then they do pathological diagnosis. Sometimes they call needle biopsy. So all these are used to diagnosis. Yes. So knowing the cause, the risk factors, how it's supposed to be screened, how it is diagnosed. Now there's a standardized schedule for screening for everyone that I would like us to also take note of. The recommended screening schedules we have for people between ages 20 to 40 years, they are required to have a monthly self-breast examinations. This can be done preferably a week after menstruation, and then a 3-yearly clinical breast examination. When you are getting to 40 to 44, we advise you do monthly breast examinations, clinical examination, and then also a 2-yearly mammogram. But the high risk zone, which is 45 to 55 years, we advise that you do monthly self-breast examinations, yearly mammogram, yearly clinical examinations. This is the key. Then after 55, mammograms can be done every 2 years. Indeed, early detection saves lives. That is why the talk on breast cancer is done almost every year in October. This we do it most often because over 90% of breast cancer cases are self-detected in those who haven't even had a mammogram. That is why every October we encourage at least self-breast examinations. Most people come, I have seen something in my breast, and we go on to probe further, and then we find that there's something really wrong that needs to be taken care of. So again, I'm going to share another video that will take us through the steps of how we can do our own self-screening. It's very concise, it goes straight to the point, and it takes it slow for all of us to be able to get understanding about how to do it on our own in our homes. So let's get tuned in once again whilst we watch the video.
Breast cancer is a type of cancer that you may be able to detect yourself. Breast cancer originates in the mammary glands, so make sure to check the entire mammary gland area. Check your breast once a month, ideally around the end of your period, as your breasts are softer. If you're no longer having periods, choose a day such as the day of your birthday to do the monthly check. First, check the appearance. Observe your breasts while raising and lowering your arms. Look for any changes in breast shape, difference in size between breasts, puckers, dimpling, and sores. Squeeze each nipple softly and check for bloody discharge. Check the upper part of the breasts that are easier to check in standing position. Breast cancer tends to develop in the upper outer portion of the breast. About half of breast cancer cases are found here. So, we'll help glide your fingers easier. Use these 3 fingers to press breasts. Start from the top. Press and feel. Repeat this process while gradually moving downward. Be sure to use the pads of your fingers rather than squeezing the mammary glands. Next, move to the area under the arm. Feel for any swelling of the lymph nodes. Move your fingers horizontally towards the breast. Do a self-check lying on your back as well. Focus on the lower half of the breast. It's easier to check this part when the breasts are spread flatly. Use your left hand to check the right breast. Raise your right arm. Press the breast with the 3 fingers of your left hand. First, gradually move the fingers downward, pressing and feeling. Next, gradually move the fingers horizontally from outside to inside, pressing and feeling. Lastly, feel the entire breast in a circular motion. Then repeat these steps on your left breast. Make sure to cover all the area.
Yes, so that was very concise, straight to the point, and everyone could really get the steps as it went on. This is just a pictorial view of how you can also do it. If you didn't get the video right, you can just zoom in and then look at the steps 1 to 6 and then do it on your own. Again, I also have something for our men because in the video that we used to start the presentation, we saw a man being diagnosed with breast cancer. So our men should not be left out. So let's also go on to their own. It's quite short.
Is your risk of breast cancer? Check once a month. It should only take about 5 minutes. You can check when you wash. Looking in a bathroom mirror. Put one hand behind your head so that your chest is fully open. Use your other hand to check your chest. Check the area from below your nipple to your collarbone. Use the flat of your fingers and press gently. Start by checking for any lumps behind your nipple. Then check the surrounding area, moving your hand up and down in a vertical pattern. Finish by moving your hand up into your arm, feeling for any lumps there. Look out for any changes, such as a painless lump or thickening under or near the nipple, dimpling, wrinkling, redness, scaling, nipple inversion, or discharge from your nipple. Repeat for the other side of your chest. If you notice anything unusual, contact a doctor. Sign up for a text reminder. Check your text and reduce your risk of breast cancer. breastcanceruk.org.uk.
So yes, breast self-examination. I mean, if you happen to go through this and then you find anything unusual, do not panic. Most of the time, the alarms that we feel are not conscious. Yeah, the ones that we feel when we do the examinations are not conscious. Just book an appointment with your doctor for further examinations to be done, just to clear any doubts. So now knowing all this, how do we manage breast cancer? The management is in various stages, and it depends on the type and also the stage of the breast cancer. Depending on the stage and the type of cancer you have, the treatment can be surgery. And with the surgery, we also have types of the surgery. We have the lumpectomy, where usually they only remove the area of the breast with the lump or with the cancer. And we also have the mastectomy, where they remove the entire breast and also remove some lymph nodes that are in the armpits. And other treatment options also with the surgery, some patients now can have nipple preserving mastectomy where they save the entire breast skin and nipple complex and they're able to reconstruct the breast again using fat or muscle from the body or even implants. These are done with those who have body image issues and will still want to have their breast in place. There are also other options. You have the radiation therapy, chemotherapy, hormone therapy, also targeted therapy. Breast cancer treatment usually involves a combination of all of these, depending on the stage and the type of cancer that you have. And one treatment or one management option that usually goes unmentioned is psychological treatment. This is very, very important. Many people with cancer do not seek psychological support, which can be a very big mistake. The challenges are real. There can be anxiety. You may even go into depression. There may be uncertainties about the future, fear of pain. We all know how cancer pain is, and decreased self-esteem. All these things let those who are diagnosed go through a lot of psychological stress. And even with their caregivers, they also need a lot of psychological support. And so the theme for this year's breast cancer month, which is no one should face breast cancer alone, is one that is most befitting. Yes, indeed, we have to reach out. If you have been diagnosed with breast cancer, it is not the end of the world. Reach out for help. Call people that are close to you, your loved ones. And also, if you are also reached out to, find time for those who reach out to you. Together, let us support ourselves through this fight against breast cancer. There are also the peer support group, and these are people who have been through the disease already. They fought it and then they are living their normal lives. This gives support to newly diagnosed breast cancer cases. So there's someone like me service available where people who have been in the situation before are contacted. They share their experiences with newly diagnosed, and then they're able to also go through the process very well. We also have the peer navigators. These ones are with the health centers and the hospitals. So they come around and help people who have been newly diagnosed by sharing their experiences with them, sometimes just listening to them. And when people know that there are others who have been through this, they've survived it, it gives them the edge to also follow. But the treatments can also be very painful. And indeed, best protection is early detection and treatment. That we can never say no to it. So the fact is that the survival rate for breast cancer located only in the breast is about 99%. So let's seek treatment early for a good prognosis. There are many who have been through the surgery and through treatment. As we can see in the image here, some have lost two breasts, some have lost just one. And breast cancer is no respecter of race, as we can see. We are all at risk. When we listed the risk factors, we saw it's not just having the family history or having the gene mutation genetics. That is not all. There are so many other things that most of us can find ourselves in one of these. So let's not stigmatize others who are going through it. And also let's see it not as a death sentence. People go through it and they're able to live normal lives. So to this point, what is the take-home message for this presentation? Let's keep our weight in check. Let's be physically active. Let's eat well. Limit alcohol. In fact, zero is the best. No smoking. Breastfeed if it's possible. Avoid birth control pills, particularly if you are above 35 years or if you smoke. Avoid menopausal hormone therapy. And also, there are some medications for high risk groups. So if you are in that group, you can see your doctor, you talk to him or her through it, and then they will help you with how to prevent your risk of getting breast cancer. Again, there are a lot of myths associated with breast cancer. Let's clear some of them. Sucking a partner's breast cannot prevent breast cancer. This is a myth that people talk about a lot. However, it is encouraged because by doing so, we get familiarized with the breast and then may identify any unusual lump early and inform the partner even before he or she is aware of it for them to seek further treatment. Breast cancer is treatable. It is not a person's fault. You will not die if you have a mastectomy, and you can still dress and look beautiful as a woman if you have a mastectomy. Me sitting here, if I have had a mastectomy, I mean, you will not know. I can just have a padded brassiere and wear in my dress, and I'll still look nice. So we shouldn't shy away from mastectomy, but that is what makes the disease spread to other parts of the body if it is not removed early. And breast cancer, it is not only a woman's disease. Using a deodorant will not cause breast cancer. Wearing a brassiere will not cause breast cancer. The underwires of our braziers does not cause breast cancer. Nipple piercings does not cause breast cancer. Using of mobile phones and IVFs will not also cause breast cancer. So healthy living is the must. Let's make every effort to age in good health. Breast cancer prevention might seem like a big challenge, but making these small lifestyle changes can yield big results, big and healthy results in the end. It's my goal to encourage healthy aging all the way so that we can all live happier lives as we are aging. In conclusion, let me say you should know your breast, you should love your breast, you should look at the breast, you should touch the breast, and then seek early treatment if anything unusual is noticed. In the end, you stay healthy and feel good. So let's not keep this message to ourselves. Let's spread the message to our significant others, our sisters, our wives, our partners, our mothers, our grandmoms, our colleagues. Anyone needs to be informed. If this October that has just passed, you were not screened, please start checking, start screening. It's not too late. You may save someone if you educate the person on today's presentation. So to end it, we are still in the Activate 2028, is still the action month. Let's take action against breast cancer. Thank you very much. Any questions?
Thank you, Barbara. We do have one question so far. Amanda has asked, you referred to mammograms at the age of 40. The NHS offers mammograms from the age of 50. Is this something you can request before the age of 50 on the NHS?
Well, this is a universal presentation. And like I mentioned earlier, Africans have an earlier age. So usually 50 is the peak. 45 to 55 is the peak. But we advise from 40 because some may develop it earlier on. And so we don't want to take chances by waiting till 50 years because you may not know if you fall within that lesser group of those who get it before 40 years. So at least when you do one at 40, then every 2 years you do. But to wait till you are 50, you may be in a at-risk group that you may not know. And the earlier you get it, the better the prognosis.
Okay, thank you. We just had another question come through. 2 more questions come through. So the first question is, would transgender people who have gone through top surgery be at risk, or is it therefore not possible for them to
I
develop
didn't
breast
get
cancer?
the earlier part of the question.
Yeah, do you want me to read the question again?
Yeah.
So they ask, would transgender people who have gone through top surgery be at risk, or is it therefore not possible for them to develop breast cancer?
Yes, they're at risk because of the hormonal therapy treatments. So they're at risk.
Okay. Another question. Someone asks, they are now on postmenopausal, or they're now postmenopausal and are on HRT. And they ask, would you recommend stopping HRT?
I would not want to say stop behind the screens. Usually you talk through with your doctors. There are many things that we take into consideration before sometimes you weigh the risks and benefits. Some of the postmenopausal symptoms are very severe. So behind the screen, I will not say stop or continue. Speak with your doctor, and with breast cancer in mind, you can have a way forward.
Okay, thank you. And I think you just answered this one. Someone asked about the risk in taking HRT in recent years. Yeah, so we got another question that says, what can we look at with our risk assessments for women who are going through treatment for breast cancer? Should we look more closely at manual handling, for example, or build in special control measures for fatigue?
Yes. For those going through treatment, we look out for a lot of things. Malhandling is one, stigma is one, even psychological treatment. There are lots, if you say we'll even go through it, there are lots of stages that they are taking through. So usually there's malhandling, there's stigma, and even the treatment options themselves have a lot of signs and side effects that we need to look out for. So that when a particular symptom or signs is becoming too unbearable, there are other treatment options that we can combine to reduce the effects of whichever one they are being put on. So it's not just a one blow thing. No.
Okay, thank you. And someone has asked, will they be able to have a copy of the slides after the presentation?
Of course, with the videos, they are all going to be shared.
Okay, that's fine. Yeah, I will send over a copy of the slides to the attendees once the session's finished. Someone else just asked as well, how long should you be on HRT?
How long should you be on?
Yeah, how long should you be on HRT?
I'm not getting the last word. Hormone replacement therapy.
Yeah, hormone replacement.
Yeah, that's why you see behind the screen, I don't want to give definite answers. Some of these things we talk through with our clients, and we consider a lot of factors. If I say 1 month, 6 months, 1 year, some people may not fall within that. So I don't want to give definite answers behind the screen. For such clinical questions, it's best you come to the hospital. We look at your what you are trying to do, your risk factors. There are so many things we look at. So I will not give a definite answer to such questions. Please visit your health provider, talk through with it. Always let's have breast cancer in mind, especially if we have a high risk. And then we can come to a conclusion where we can be within the 23% preventable groups. That is very, very necessary.
Okay, thank you. And someone has just asked, is sex life can sex life be related to breast cancer?
Is what incest?
Sex life.
Let me see if I can get the question in the box. I'm not getting the question.
So they're asking, can like people who have an active sex life, is that related to breast cancer?
No. There's no relation. There's no relation. There's no relation with sexuality. There's no relation with sexuality at all.
Okay, thank you. Okay, we do have one other question. It was similar to the one earlier, but we'll ask anyway. They're asking, how significant is the risk from taking HRT? As they're saying, in recent years, it's been implied that the risk is not as high as they once thought.
I'm trying to, how significant is the,
Yeah, is the risk in taking hormone replacement therapy in developing breast cancer?
The risk is high because usually when you have high estrogen levels, then the gene starts behaving abnormally. You know, breast cancer, you can't know the cause, but then you know the gene mutations. So the moment there's a high a particular hormone, then the body itself starts behaving abnormally. So for the hormone replacement therapies, the risk is high. That is why, in as much as possible, unless the risk outweighs the benefits, then you know what to choose. But so always in such instances, we weigh the risks and the pros and cons. Some will need it anyway. So for those ones, the risk is there, but we still have to give the therapy. But if we look at the pros and cons and you can go without it, then we advise you against it.
Okay, thank you. We've not got any more questions through now. We'll just give it a few minutes and see if we get any more through. Okay, we've not got any more questions through. Okay, people are just sort of saying thank you. Someone has asked, is there many men who attend your webinars, like these speaking sessions on breast cancer?
Yes. Usually I have a lot of men. I even have only men group. I remember earlier this month I had a webinar for a group. The workers were basically all men. And for men involvement, it doesn't have to only be the man getting breast cancer. Yes, because I mean we have partners, we have moms, we have aunties, we have daughters. So even if it may not even be for you, you can always educate someone. So it's not just for men. It's not just for men. It's for both men and women.
They've asked as well if you run menopause webinar sessions.
For menopause, no, not yet.
Okay, thank you. Okay, I think that's all for the questions.
I'm just seeing that the sound quality was low. Was it that low?
What was that, sorry?
I'm just saying that in the box that the sound quality was low. Was it that bad? I didn't see earlier.
The poll?
I mean the sound quality. I'm just seeing in the message box that the sound quality was low. I didn't know. But was it that bad?
No, it was all okay, thank you.
Oh, okay.
Okay, if that's everything then, I'll thank you all for attending today's webinar, and please look out for more webinars from the Public Services Group.
All right. Thank you all very much.